Well, Dr. Harris, thank you so much for coming and visiting with me this morning, and appreciate you always having a measured response and a very carefully thought out response for us to share with our people. And I keep getting asked questions when I'm out and about with the media, and they seem to ask the same old questions. So hopefully we can get the answers out there and people will start believing them. So if you don't mind, I've got a few that I've written down that folks have asked me.
Yes, ma'am. I'd be glad to do it.
First one is, if you've already gotten COVID-19, do you still need to get vaccinated?
Yes, you do. We get that question a lot too. It's true that if you've gotten COVID-19, you have some antibodies on board for a while. You're probably protected for a few months, but we don't always know how long. We've had now almost 5,000 people that we know of in Alabama who've been infected at least twice, and some of them, believe it or not, even 3 times. And unfortunately, if you get infected that second time or that third time, your chances of ending up in the hospital or dying are just the same as people who get it the first time. So we do want people to get vaccinated even if they've been infected. Actually, the best immune responses we know of occur in the people who've had the disease and then later get vaccinated. They have the most protection.
That's good to know. Next question. As a follow-up to my first question, the people who are voluntarily getting the shot, will they be completely immune to getting COVID-19, or can they still catch it?
Well, they still can catch it, but not very often do they catch it. You know, this vaccines that we have is over 90% effective, maybe 95% effective, and that actually makes it one of the best vaccines that we even know of. But there's still about 5% or maybe 10% of people that can get what we call a breakthrough infection anyway. Now, those people are usually protected. They don't usually get from being really sick or from dying. They usually don't get sick as often. They usually don't die. But it is possible to get it, just like with any vaccine, you can have a breakthrough. So right now we've got about 1.6 million people in the state that are fully vaccinated. And we wouldn't be surprised to see 5 or 10% of those people, you know, which is a lot of people, come down with infection anyway. But the vaccine does keep them from getting very sick in most cases.
So it's still a good thing to do to take the vaccine.
Absolutely right. It's always better than taking your chances on getting COVID.
Well, the third question, thanks to Operation Warp Speed, we discovered a vaccine that is effective within a year. However, some folks still are concerned about side effects. Knowing this, what would young women need to know about any potential side effects and if it would harm a pregnancy?
Sure. We get a lot of questions about a woman's fertility and about pregnancy and whether the vaccine is the right thing to do. I think any woman who's thinking about having a baby or who's pregnant, certainly that's foremost in their mind, because they want to make sure their baby is safe and protected and they're not doing anything to harm it. We know that these vaccines don't affect fertility. In fact, I don't know of any vaccine there is that affects fertility, because vaccines just don't work that way. That's not something they do. But these vaccines have been studied as much as any vaccine has ever been studied. And even though the vaccines came out really quickly with Operation Warp Speed, no one took shortcuts on the safety of those. And we've had many women now who've gotten vaccinated, who've gone ahead and gotten pregnant, and now are actually starting to have their babies now. And there's no issues related to that at all. One thing we do know is that pregnant women are a little bit more likely to do poorly if they get COVID than an average person. Pregnancy, it weakens your immune system a little bit in a way. So if you're a pregnant person, we definitely want you to be protected by getting the vaccine. But as always, talk to your own doctor. Ask your obstetrician what he or she thinks and take their advice.
Well, I think that's some of the best advice, is talk to your local health provider, the person that takes care of you and your family on a daily basis.
That's right. You know, the person who knows you best is the person who ought to help you make those decisions. You know, any medical decision you have is best answered by your doctor or your pharmacist or your nurse practitioner you see, whatever provider gives you your health care. They're the people who know you best and will give you the best advice.
The next question, we know that children under 18 are a lower risk from serious effects from the virus. What do you say about parents who are considering getting their children above the age of 12 vaccinated?
That's a really good question again, and it's sort of similar to the previous question. You know, I think the first answer always is talk to your child's doctor, talk to their pediatrician or the nurse practitioner they see, or whoever gives them their health care to help make those decisions. But right now we only have a vaccine for ages 12 and up. We don't have a vaccine that's available for anybody under 12. And we know that there are a lot of kids who still get infected with COVID. You know, the one, I guess, good thing, if there is one, about COVID is that children usually don't get that sick. And we're happy to know that, but still sometimes they do. Just this past week we had almost 36 kids, pediatric patients in Alabama hospitals around the state on one particular day, and that's a lot of extra children in the hospital. And we're just now beginning to understand the long-term effects of COVID. I'm sure people have heard of what we call the long haulers or the long COVID syndrome. These are symptoms that can last for months and months and months. In adults sometimes too, but particularly in kids. And so any way we can protect our kids from getting infected is a good thing. And finally, I would say, because we have this Delta variant circulating, it's so infectious that anybody who gets COVID is likely to spread it to 3 or 4 other people on average. That's about how it works out. So if you have a child, your child may very well do just fine if they get COVID, but you know, they may be around a parent or a grandparent or even a teacher at school or somebody that has health problems or somebody that might be put at risk.
Dr. Harris, I think there are a lot of people who are hesitant because the FDA has the vaccine under emergency use only at this point. What would you advise those with that worry?
That's a very smart question to ask. You know, the answer is that I would recommend going ahead and getting vaccinated, which in fact I have already done, and asked my wife, who's vaccinated, my parents have gotten vaccinated, our kids and our grandkids are old enough. We've all gotten vaccinated, even though it's not a fully approved vaccine yet. And it really lies in understanding that approval process. When a new drug or vaccine comes to market, it can take years to get that approved because there's a lot of bureaucracy, there's a lot of red tape you have to go through. Operation Warp Speed did a great job of cutting through all that red tape and bureaucracy and getting this vaccine out to start saving people's lives. And again, as I said earlier, they didn't cut corners on safety, but the actual process is going to take a few more months. We think that we'll have them fully approved in the next 2 or 3 months. But again, we have a lot of COVID disease out there, and my advice would be, please don't wait for that process. Please go ahead and take the vaccine. I did great with it. I was actually there with you, Governor, when you got your shot, and I guess I'm curious to know how it went for you.
Well, it was fine. It didn't hurt a bit to get the stick, and I didn't get it sick or feel bad or anything. It was just in and out and over and done with.
That's great. That was my experience too. So we hope people won't wait. That approval is coming. It'll be here very soon. But I would advise people not to wait on that.
Well, Dr. Harris, finally, where can Alabamians get more information about the COVID-19 vaccine here in Alabama?
The easiest place, if you have internet access, is go to vaccines.gov. You go there, just put in your zip code. It'll show you every single place that has vaccines in your area, and it'll give you lots of information about who the vaccine is recommended for and who should or perhaps shouldn't take the vaccine. You're also welcome to please call your local county health department. We have people who are staffing that all day during business hours who will be glad to answer those questions.
Well, thank you for answering these questions. That's very helpful.
Yes, ma'am.
And I think the best advice you gave today was everybody that's still hesitant, check with your own personal health provider and ask what they think, because they know you best.
That's absolutely right. That's always the right answer.
Well, thank you so very much.
Thank you very much, Governor.